Thanks very much, Angela, and thank you very much. I have found this morning really stimulating, and there are a lot of threads that have run through various presentations. I'll maybe try and pick up on some of those as I give my own presentation. What I'm actually going to talk about is the, if I can find the arrows here, the Making Life Better strategy in terms of the strategic context for what I want to say. But basically, I want to return to that theme that looking after ourselves is really important, because sometimes we are so busy looking after everybody else, we forget about our own care. So I'm going back to that theme of health and well-being of the people, that is yourselves, the key resource in the service. I want to talk a little bit about the two-way relationship between health and work. And then I want to put forward for you a model of health improvement within the workplace that has been developed by the Public Health Agency and is in place with a number of employers. And then I want to reflect a little bit on action we're taking within PHA itself, but also for yourself in your own lives. So, as I say, we'll pick up on a number of those themes. The first thing in terms of context is the diagram that Pedro actually used. Only he beautiful little people in it, and diagram. But it's this issue that health is really more about what we call the determinants of health, and they lie outside the health and social care system. We have an important role to play within the system, but the major influences lie outside of that sector's control, which means that when we're developing approaches to improving health, it is incumbent on us to work with others, whether it's in the community setting, whether it's other sectors like education and housing, local councils, and so on. We really need integrated approaches to tackle some of these real challenges because they are inextricably linked. We've a lot of evidence to help support us in that. The World Health Organization will set up the Commission on Social Determinants in Health, led by Professor Sir Michael Marmot. And his work has really been setting the direction for us in terms of tackling this most invidious, this strongest challenge, which is inequalities in health. So I want to say a little bit about that in terms of context, because this really defines what is the challenge for us in Northern Ireland. So the good news is, if I hope you can make this, I'll give another slide later which is a little bit more detailed. The good news is we are effective. We now have extended people's life expectancy by several years, and that is really a huge achievement. However, what we haven't done is reduce the differential between those that are most well off and those that are least well off. And it is that variance that is our constant challenge and will require us to work on those factors which lie outside of health and social wellbeing improvement and the sectors. Now, what we have been doing is, some of you might remember Investing for Health, which was the first government strategy across the executive. The revised version is now Making Life Better, and that's what I'd like to spend a little bit of time on. It is a vision for integrated work across government departments, across agencies, working with communities. Now, that's very high and lofty in terms of aspiration. It's much more difficult to put it into operation. However, we do have the benefit of the experience of Investing for Health, some 10 years, and before that, many people have worked in this area. So we've got a new opportunity with the health framework, because this issue of working across government and working across ministers has really been nailed. We now have, if we had a government, an interministerial committee that will actually look at that. And I know we can all be cynical about politics, but on the one issue of suicide prevention, I have seen massive developments of cooperation by each of the ministers working together in a coordinated manner. So my hope for this is actually sincerely very high if we can get our government back up and running. However, the point is that it's integrated. Now, there are a number of themes to that framework, and they address the very early years, children and young people, adult life, and settings, whether that be communities or whether it be in the health and social care sector, and as I say, importantly, collaboration. One of those things of Making Life Better is the fifth one, empowering communities. And the specific setting that is one of the highlights is the workplace. So what are we doing within our workplaces to promote health and well-being? And how within this workplace, that is health and social care sector, are we going to interpret that? So that's what I'd like to spend a little bit of time thinking about now, the nature of that two-way relationship. And the work that has guided us is Dame Carol Black's work on workplace health, working for a healthier tomorrow. And she highlighted three things: prevention of illness, intervening early when someone becomes ill in the workplace, and thirdly, those people who are out of work, working hard to get them back into work. Her work has really set the direction for what it is we now know about workplace health and what we should do to make the most of that valuable resource that is our staff. So in terms of Northern Ireland, I've mentioned the life expectancy. It's got better. As you can see, that's men. This is women. Again, it's got better. We know that the primary causes, though, remain the same: coronary heart disease, cancer, and respiratory disease, in terms of causes for both sexes. An overview of some of the challenges we're facing that you're seeing day and daily. About 2/3 of us are overweight or obese. 2/3, almost 2/3 of the population. And when we come to children, it's smaller, it's 20% are overweight or obese. But we're looking ahead, and it is a bit challenging. Less than a third of us are meeting the required recommendations around physical activity and fruit and vegetable consumption. And safe drinking, about a fifth of us are keeping are going over those safe recommended limits. I'm not going to ask you what you're doing, but I'm just putting this because we also reflect part of the population we're working with. So there's some good news in there. In terms of smoking prevalence, it's coming down. In fact, we had a drop of 3 percentage points last year, so we're down to 22%. There's still a differential there, but the good news is that our services appeal and reach to those that are most disadvantaged just as much as they do to more disadvantaged groups. So that is actually very encouraging. But the issue with obesity, if you look at that over time, is that we're not really yet beginning to see any impact. And if you look at our alcohol consumption, it's fluctuating if you look at that over time. But the good news is it's beginning to come within recommended guidance. Now, the one that I'd like to spend a bit of time for in terms of nursing is mental health. So, for the population as a whole, 1 in 5 of us experience difficulties with their mental health. And this is really a very common problem that you are probably encountering every day, and also with your colleagues in work. But it's also an issue which carries taboo and is harder to deal with in many situations. We know that mental health problems have the greater impact on people's ability to work than any other group of disorders. So we can't ignore this. So in terms of that two-way relationship, one of the things that Bevan has highlighted is that this interrelationship between work and health really does work both ways. And it's possibly self-reinforcing that healthy employees are more committed, and more committed employees are generally healthier. So it's a win-win if we get it right. But one of the things we've got to do is take it seriously. So well-being is associated with improved learning and performance, reduced absence, less sickness, less risk-taking behaviours, improved physical health, and of course higher engagement both with the workforce and local communities. So these are important outcomes. I mean, Pedro talked about joy and about connecting different bits of their lives. This is really serious stuff if we take it forward. So I think I went back there. If we just think about the costs, 70 million working days in the UK, massive loss of productivity, not to mention the staff turnover that Charlotte referred to. So in the Guardian article in 2015, they highlighted that nurses taking time off due to stress has risen significantly. The RCN report in 2012 pointed in their report beyond breaking point, high workload, fast pace of working, long hours, detached from changes that were going on in the workplace, and staff engagement. Now, the wider evidence could reinforce that. It's the health and safety executive have highlighted demands, workload, work patterns, environment in general, the amount of control you have over that, the say you have in that, the support provided by your organisation, whether that's through your line manager or whether it's through others and staff policies. The importance of relationships, and it again was Pedro who talked about the importance of emotions that can affect. So if the relationships and the emotions are positive, it has a positive impact, but we can also go in on the negative. And also, if a role is unclear, that's threatening for people. They're uncertain of where they stand. And change, how we manage change within an organisation, which is constantly changing, is a perennial issue. So the effects of that stress are significant. 1 in 5 people will take a day off work due to stress. 19% of staff feel they can't speak to their manager about it. And indeed, the good news about that is that 56% of employers would like more help in terms of how they deal with that. So these are real challenges, and we have a responsibility, every one of us, to start thinking about what is it that we can do that will actually tackle some of these. Charlotte also mentioned a concept called resilience. You know, it's how we cope with those challenges both in life and in our working life. What is it that will help us? This quality of bounce back ability to roll with the punches. So we know now that some things will help us. And the New Economics Foundation has a concept that they call Take 5. And we're now using it in Belfast and rolling it out across the region. So what is Take 5? It's 5 ways to well-being that we know will help. And I think they connect with some of the things we've already been talking about. So connect. Build your relationships with family, friends, colleagues and work. The kind of environment we create is singularly important. Physical activity, you're going to do that later, and the sun is still shining. But any kind of physical activity is better than none. And we now know that it's not just physical activity, it's avoiding sedentary behaviour. So get up and move. Be alert, be curious, pay attention to what's going on, and savour the moment, and I think you will be getting a session on mindfulness. But it is about really engaging with the here and now. Do a new thing. We all need to learn things, and that's a challenge both for our brains and in every other aspect. Keep ourselves alert and active. And then the final step is to give, to think of others, to smile, to be grateful, to engage with the world in a way, in how we walk in the world, as it were. We know that these 5 steps improve this elusive concept of well-being. I think there's a lot in that for how we both work and how we live our lives. And in terms of benefits, I've mentioned absenteeism and this other concept of presenteeism, but we also know that it increases motivation, and particularly for an employer, it improves the image of the employer. People want to work with good workplaces. It's actually appealing, it retains staff, and it increases the quality and productivity and creativity of staff. And that came from the Work Foundation in 2010. NICE have also identified a number of recommendations that they make around workplace health, and I know we're expecting a new set of guidance from NICE. But there's a lot of evidence now. This isn't just wishful thinking, this is stuff we need to take, as I say, very seriously. And perhaps the most important area is how it reflects on quality of care, which again Pedro and others have referred to. The quality of care depends not just on skills, but on the commitment, compassion and empathy, which Pedro highlighted, of staff. That's our most precious resource. So addressing the mental health problems, staff health and well-being, and creating a happier workforce will actually improve outcomes and improve quality. And the importance of engaging staff in that process is fundamental. We can't impose it on people, we've got to work with people. Just as we know with community development, we need to engage and work with people, so it is with workforce. And someone a little bit longer in the tooth Charles Darwin saw this need for flexibility. So it's not the strongest of the species that survive, nor the most intelligent, but the most responsive to change. That's the world we're in. So what is the workplace model that I'm suggesting then? It comes from the World Health Organization, and it is saying that we need to look at the dimensions of the workplace, not just what food is available, that is important, not just what policies are in place around staff leave, but the physical and psychosocial environment, the kind of engagement opportunities, and that we plan it systematically to assess need, to drive action, to plan, prioritise, and connect the policies of an organisation, the culture, the leadership of an organisation with individual opportunities for members of staff. So we've now been translating that model into practice, and we've developed this tool called Health and Wellbeing at Work, a resource guide. So that is being used by employers in Northern Ireland, and we're also working in different parts of the sector of health and social care. There's an online tool, and it takes you through a step-by-step guide, assessing need, planning how we address the need, connecting it into culture and policies, and delivering change on the ground. We've got to be systematic about this. And our experience of that has been very helpful. Now, we know that many of the trusts are also looking at this issue. I know in particular Belfast Trust, for 2 years now, a staff health and wellbeing group have been working hard at this. So it's not as if we don't know something about it, but I think it's a time for us to give it renewed emphasis. And I know that the Trust are about to launch an app that they have been developing shortly. So, it's fantastic, but it's also something we need to help build the momentum around. The other thing is, and not to forget this, we know that good line management is singularly important in terms of how staff feel, the participation that they experience, and the delegation. And the Health and Social Executive have given us a number of indicators for stress management. So it's important that we train staff. We help them understand this psychosocial environment that is so important, and we help them to encourage others to participate and to share. So it's a continuous process of improvement that we're talking about here. It's not a flick a switch. We're going to have to build on this, and many people are already. But I think we do need to get a bit more systematic about it. So in terms of personal action, I've already said I think we need to take it seriously, and I do. I mean, it's joyous, but I think we need to take it seriously. And that requires us within the workplace to find a mechanism for bringing people together and connecting it into the other parts of the organisation that I mentioned, and challenging each other, but ultimately developing an action plan. So getting started is sometimes the hardest thing. And I was reminded by Seamus Heaney's piece on getting started. Keeping going, getting started again. In art and in life, it seems to me this essential rhythm, not only of achievement, but of survival. The guarantee of credibility in your lives, credibility to yourselves, as well as to others. Stopping, starting again, refreshing, reinvigorating. I think this is essential when it comes to this area. So what have we been doing in the workplace that is the Public Health Agency? Well, we're no paragons of virtue, but we have been doing our bit. We had a climate survey in 2012, and it gave us some uncomfortable messages about how people felt about the organisation. However, what we did do was look at that and build a number of changes around policy and a number of very practical issues, including establishing a working group with membership from across the organisation, and then looking at practical development opportunities for staff. So at the minute, we've already made reference to walking. With walking, and the senior management team have agreed to match time by 15 minutes twice a week. So that enables staff to get a 2 half-hour slot each week to go for a walk or a run or whatever it is. We've established the LGBT forum across the health and social care sector and developed a new learning forum around LGBT staff who felt often very isolated in the workplace. Volunteering, we've mentioned, and the value of that. Active Belfast, and you saw the bike out there, with a number of programmes that we're working on leading, as it were, by example with other employers to make active travel much more achievable. And finally, I suppose, just a couple of reflections. You can't keep giving unless you put something back in. And I think sometimes in our sector we give so much, but no one is reminding us to give back to ourselves. And that replenishing of the resource is incredibly important. We know now a great deal more about mental health and resilience, so I think we should pay attention to it. And I leave you with the final thought from Maya Angelou, who many of you may know. She's a poet, an activist and a writer. And I think in terms of our mental ability and our ability to change, it's worth reflecting that if you don't like something, change it. And if you can't change it, change your attitude. Thanks very much.